started the timer and here is your question. Right, if you have read and understood, kindly begin your examination.
Okay. After entering the room, I'll wash my hands and introduce myself to the patient and confirm the name and age of the patient. If the patient is wearing the oxygen mask, I'll take the permission to remove it so that I can hear the patient. Then I'll take the permission to examine him. That will include the looking, feeling, and listening to the chest and other parts of the body. And then I'll request the patient for the exposure of the chest and abdomen. I will ask about the pain, if he has any pain at the moment, and ask the patient to point to the site of the pain and if he needs any painkiller. As patient has chest pain and severe chest pain and also breathlessness, I'll start the KISS protocol. And at the same time, I'll ask the patient if he has any tummy pain. And then I'll immediately also connect the cardiopulmonary monitor. I'll start the KISS protocol according to the ABCD format. First, I'll see the airway, and as the patient is talking, so I assume that the airway is present. Then I'll go for the breathing. I'll check the breathing. I'll ask the patient to open the mouth and stick out the tongue. I look for presence of any cyanosis or any signs of dehydration or any oral hygiene. I'll feel the trachea and see if it is central or not. Then I'll take a closer look to the patient's chest and see the chest wall movement. I'll try to percuss the chest and see the percussion note, whether it is dull or resonant or hyper resonant. Then I'll go to listen for the chest for the breath sound and any added sound. I'll ask the patient to sit upright and fold their arms across their chest while hands touching the opposite shoulder. Then I'll examine the chest also from the back by looking, feeling, and listening over the supraclavicular, interscapular, and intrascapular areas. After that, for the circulation, I'll ask the patient to lower the lower eyelid so that I can check the pallor. I'll also see the neck veins. Asking the patient to incline at 45 degrees to see if there is any raised jugular venous pulse or not. And then I'll listen to the heart sounds and see if I can listen any murmurs or not. For then I'll see if the patient is alert or not. As the patient is talking, according to AVPU, as the patient is talking, so the patient here is the alert. And finally, I'll ask the patient for the exposure of the lower limbs and also the exposure of the surgical wound so that I can check the wound. I'll take the permission from the examiner to check the surgical wound. After that, I'll squeeze the calf muscles to see if there is any tenderness present or not. I'll also see if it has wearing any intermittent pneumatic devices or not there. And after that, I'll thank the patient and ask if he needs any other help. I'll cover the patient. I'll put oxygen mask back to the face, and then I'll wash my hands. Then I'll ask the examiner for the patient's charts and files to check the vitals and other data. And if I'll see what is the heart rate, blood pressure, and respiratory rate of the patient, I also see the oxygen saturation of the patient and how much, at what rate the oxygen is being given to the patient. I also look for the temperature. Uh, today,
Yes, you may present your case now.
yeah. Today I have examined this 52-year-old gentleman who is a post of day 8 after the right total hip replacement, who presented with chest pain and breathing difficulty, and he is hemodynamically stable at present, but there is decreased saturation on about 88% on the 2 liter of oxygen. And this has been improved after giving the high flow of oxygen. Patient also has a swollen leg and painful left side of calf area. His chest is clear with bilaterally normal air entry, and the percussion is also normal. And there is no signs of pneumonitis or pneumothorax. While I am suspecting also the myocardial infarction, so I'll be waiting for the coming for ECG and the blood troponin test result also.
So what are your main differentials right now?
So seeing this all signs, my main provisional diagnosis is the pulmonary thromboembolism.
Okay. What investigations would you arrange other than ECG and troponin?
If I'll see if the patient's renal function is normal or not. If his renal function is normal, I'll arrange for CT pulmonary angiography to exclude the pulmonary embolism. I'll also advise for chest X-ray and serum D-dimer level.
Yes.
And I'll also see the arterial blood gas analysis to see if the patient is in any acidosis or alkalosis. And I'll see also the ECG, which will show that there is a right ventricular strain pattern, like there will be T wave inversion in the chest lead B1 to the B4, and also in the lead 2, 3, and AVF. There will also be right axis deviation. There will be S1, Q3, and T3 pattern that will show the deep S wave in lead 1 and Q wave in lead 3, as well as inverted T wave in lead 3 also.
Okay, how would you manage this patient if you think that it's pulmonary embolism?
Actually, first I'll do the primary resuscitation to this patient according to the CRIS protocol in the ABCD format. After securing the airway and moving to the breathing and giving high flow oxygen, then go for the circulation. After these all initial resuscitation, the management will depend on the what type of the pulmonary embolism it is. If there is massive pulmonary embolism and patient is in hemodynamic compromise,
yes,
he needs systemic thrombolysis. I'll put a crash call so that I'll get the urgent help, and so that patient can get the systemic thrombolysis. But if there is no non-massive pulmonary embolism and patient is stable, then initial treatment will start with the therapeutic dose of heparin, and which will be followed later on by the warfarin. I also involve the medical team to follow up this patient for this pulmonary embolism later on.
Good. Just suppose you were scrubbed in the theater and you have been informed about the patient. What would your next step be?
If I have a scrub, then I'll immediately put a crash call immediately so that other people can attend the patient as soon as possible.
Very good. Within time. Excellent. Yes.
Okay,
yes, feedback. I realized Dr. Abhishek joined, but then he left. Dr. Sunday is
yeah,
here.
his network is.
Yeah. Dr. Sunday, would you want to give feedback? It was good. Did he miss anything?
I just wanted to know that during this CRIS protocol, as the patient is talking, so
Yes.
should I go the detail about the airway?
No, direct. You'll move on because patient is responding.
As I did
yes,
already
as you did.
talking to, yes.
Yes, good. So would there be anything else you'll do to complete your examination?
To at this point, because patient is in distress, so I think later on we can do the cardiovascular examination also.
Yes,
Maybe,
because you did say you suspect MI.
yeah, according to the result actually.
Yeah, good, excellent. Here is your question. Right, if you have read and understood, kindly begin your station.
Yeah. Hello. I'm Dr. Sunday, one of the surgical doctors.
Okay, yeah, doctor.
Are you the one that's supposed
Now,
to?
now my turn came now.
Hello.
Is I'm going for surgery now?
Uh, okay. About that. So I'm actually here to talk to you, speak about that. Do you have some minutes? Can you speak now? Is
Yes,
it a good time
Hello.
to talk?
What are you saying? My
Hello.
operation cancelled. What are you saying? I do not understand.
No, I said I'm here to talk to you about that. So do you have some moment to talk? So
Yeah,
like I
but
said, I'm Dr.
what
Sunday.
do
So
you mean? Why my emergency? My operation has cancelled.
basically, I understand that your operation was scheduled for today, and however, we have a later development. So, and that's why I'm here to speak to you about it. So, there has been a development
No, no, but
whereby,
doctor, my
hello,
operation has already cancelled twice. Now it is third time. What is going on? What do you
yeah,
mean by it is?
I'm sorry for that, and I'm so sorry that we have cancelled it. So, but I'm afraid I don't have the good news also for this time, and that is why I'm here to talk to you. So, I need to cancel your operation yet again. I'm so sorry. So, and
No,
the reason, come again,
sorry is
continue, please.
not going to solve my problem. I'm just asking why my operation has been cancelled.
Yeah, so the reason for that is this. We have an emergency operation due to road traffic accident. So, and the consultant who is supposed to do your operation has been called in for that emergency operation. And that is
No,
why
no,
your
you mean
operation
that
has been
my
cancelled.
operation is not an emergency? What do you
So,
mean that is an emergency?
I'm so sorry. So, based on the hospital's policy, so we prioritize
No,
emergency.
doctor, I want to talk to him right now, my consultant. I immediately want to talk to him right now. You have to call him now. Could you
Uh,
call
uh,
him now, please?
I'm afraid he's already in the theater operating on the emergency case, so I cannot reach to him now. So we have to wait until he finishes from the theater.
No,
Then,
then you arrange another consultant. I want to talk to another consultant now. I need another
yeah,
consultant.
I understand your concern, and I'm so sorry yet again. However, we don't have any consultant that's available to do the operation, and that is why I'm here to discuss with you. So we tried to look for other alternative, but there was none. I'm afraid, and
But
that's why I'm here.
doctor, I cannot wait anymore. Can you do this operation for me? Can you do this? Can you do it?
Uh, uh,
This operation?
Once again, I understand your frustration and I'm sorry. However, and thank you for believing in me. However, the laws say that I cannot perform this operation without the permission of my consultant. So, and since they are not around, I'm not allowed to do this alone by myself. I'm sorry for that.
I'm really frustrated. I'm really, what will happen to me?
So I understand your frustration.
Okay,
So what?
doctor, you give me another appointment now.
Okay,
Immediately,
so
you give me another appointment.
Good.
Please, doctor.
that once my consultant with the operation, so I will tell him, I will discuss with him, and we are going to fix you another appointment, and we'll get back to you regarding your new appointment date. I'm so sorry, Udo. And I understand that you wanted to also complain about your work. So about that, what I can do is this. I will try and contact your employee so we can write a letter for you stating the reason why you are still absent. And also, I can also extend your sick leave, so which, we give you time, so that your employee will know that you are being sick and that will not affect your work. Is that okay with you?
Okay, doctor. So can I walk can I walk right now?
You mean work? I didn't get that. You mean working or walking?
Yeah, walk. Can I walk?
Okay.
Is it
Work.
So
okay if I walk?
okay, I understand. So right now, because of the injury, I would advise you not to work on that leg. You know. So what you can do is you can use walking stick. Just take the weight off the leg. However, you can do some exercise to keep the leg in working like a swimming. It's very, I would recommend swimming because it's very good for you and to help, to take the weight from your leg while you are exercising your body. And again, I would like to recommend physiotherapy so I can uh, if it's a physiotherapy that will take up your case and help you, during the recovery process before and after operation. If that is okay with you.
Yeah, okay, doctor. I also the painkiller I am taking is causing heartburn to me. Please prescribe, give me another medication. I don't want to use the previous one. It causes too much heartburn. Please.
I'm so sorry to hear that. And I'm so sorry. So what I'm going to do with that is that I'm going to change your medication and I'll give you another pain medication that will be less irritating to your stomach. So, and you won't have that heartburn again. So I will do that right now and I'll give you another one. So do you have any other question you would like to ask me?
Yeah, doctor, just make sure that you will not postpone my surgery again because I'm really very bad sick, you know.
Yeah, I'm so sorry once again for that. And so, as you know, this because the postponement was due to condition whereby it's out of our control, and we'll try to make sure we fix your appointment date as soon as possible. However, I cannot guarantee that the next time, if there's any emergency surgery, because it's the hospital policy, so and that is why we follow the policy. So, and I wanted to bear with us, and we are very sorry. But don't worry, I will discuss my consultant. I will try to fix you in the next available slot.
Mm,
Do you have
okay.
any other?
No, no, I just want my surgery. It's okay.
Okay, so let me just go through what we discussed. Now, so I came here to discuss with you about your opinion that has been postponed. So, and I've already told you the reason why it was postponed because of an emergency surgery. So, and you requested to meet the consultant, which I'm going to be telling, and I'll make sure he sees you after the operation. Then you told me about the pain medication, which I offered to change for you. And then you talked about your work. So, and I offered to write a letter to the employee and also to extend their sick leave, so which you accepted. Then I also want to refer you to a physiotherapy that will help you manage your pain and your leg, and also I also recommended swimming for you that will also help you with your pain and the rehabilitation of your legs. So hope I'm not missing anything.
No, no, doctor.
Okay, thank you for your time. So if
Thank
you
you.
have any further question, please contact the nurse and they will get to me. Thank you.
Very good.
Okay.
Within time. Good. Thank you. Thank you, both of you.
The patient name is not given in the same.
No.
So I wanted to ask you, but he didn't allow me to ask the name.
Yes, in real exam situation, they will give you a name, and then you
Okay.
will come and you'll greet the patient with the name, because
Yeah, exactly. Yeah.
assume that
Yes,
you
yes.
already know the patient, because
Yeah.
patient
Okay.
was scheduled for surgery.
Surgery, yes.
Yes,
Yeah.
Oh,
And patient will be very angry. I am not
angry.
that much
Yes,
angry.
yes. Not like Dr. Suman, he's so cool and relaxed, but patient will be aggressive. So, and the name will be given, and you are supposed to greet the patient with the name, like as if you
Yeah.
recognize him or her, him actually. Good, very good, thanks.